Hi, my name is Wensha Noel, and today we are going to be talking about trichloroethylene toxicity. We're going to talk about how it manifests, how to prevent it, and the symptoms. Now, first, I just want to go into a little bit of information about its impact on the environment and people. So, trichloroethylene toxicity, or TSC as it's commonly known, it's clear, it's colorless, and it's non-flammable. It's commonly manufactured as a liquid chemical, and it is often described as having a chloroformy-like smell. Now, it's mainly used on construction sites to degress metal parts, but it also can be found in like household items such as typewriter correction fluids, adhesives, spot removers, rug cleaning fluids. And actually, in the past, it was actually used as a general anesthetic for surgery. About 5,000 to 20,000 BPMs were used in general anesthetic back in the 19th century, which is kind of unsettling. But TSC can stay in the body for up to 3 weeks, and it does not pose any significant secondary contamination, so you can't get it from other people. It has long-lasting cancerous effects, though, if you do get contaminated with it, on the kidney and the liver, if not properly treated. Now, a study from the National Health and Nutrition Examination Study back in 2016 actually detected that less than 5% of people in America have detectable levels of THC in their blood. Now, going into its environmental effects, it actually is very moderately soluble in water. So it can be in the soil and it can migrate into groundwater, and this can infect large bodies of water and food and crops and everything. So it has a short half-life, which makes it difficult for scientists to actually detect it via biomonitoring surveys. But the U.S. Environmental Protection Agency actually found that 700 out of 1,300 waste sites in the United States still actually contain TSC. It is a halogenated hydrocarbon, so it is used in industries such as chemistries, and as I said before, construction sites and biological labs. So if they don't dump it correctly, it can actually contaminate large bodies of water supplies in America. Its presence in the environment is why most people actually are likely to have it in their drinking water or in their food, because it's not being disposed of properly. Now, its manifestations is, as I said before, are carcinogenic long term via any routes of exposure, which include oral, inhalation, ingestion, skin contact. It can also affect the central and peripheral nervous system. Now, individuals who suffer from exposure can find that they have retrobutal neuropathy, optic atrophy, and oculomotor disturbances. So this basically means, retrobulary neuropathy is when the optic nerve in the back of the eye actually gets inflamed. And then optic atrophy is when there's death of retinal cell axons in the eye, which can cause there to be dimness in the visual eyesight. And then the motor disturbance, ocular motor disturbance, is when there's involuntary eye movement. So you can see that if you do come into contact with it, especially in your eye area, it can actually have permanent damage to your vision. And high levels of it can also decrease your sex drive. Scientists have found that sperm quality and reproductive levels have decreased. And I'm going to talk a little bit more about that in my next slide, actually. Low to moderate levels may cause toxic encephalopathy, which can be categorized by nausea and headaches and cognitive dysfunction. Now, it is worsened, so the neurotoxic manifestation is actually worsened by alcohol consumption. Now, in humans, the central nervous system effects are the primary effects noted from inhalation of TSC. The symptoms include sleepiness, fatigue, headaches, confusion, blurred vision, facial numbness, and a feeling of euphoria. as I said before, it can have cancerous effects. Now, in animals, scientists actually found that low to moderate toxicity that were tested in rats led to an increase in tumors found on the lung, the liver, and the kidney after they had it inhaled or orally ingested. So a study of 20,000 males and females reported that inhalation increased malformations following the exposure. Now, what I mean by malformations is there were adverse reproductive effects that were more commonly range from heart problems in infants and stunted mental development, and also infertility in men in their sperm quality. So its effects, now I said it last from 3 days to a week, but if you are exposed to it for long periods of times, a large amount of times, it can have lasting effects for months, going on years actually, because high levels can lead to abnormal heartbeats, coma, and possibly death. And this goes back to it being very highly cancerous. You know what I'm saying? So if you are in an environment where you are constantly being exposed to it, the carcinogenic qualities of THC can actually be something that affects you for the rest of your life. Now, OSHA actually reported that the limit for the concentration of THC is 100 to 300 BPM, which makes it crazy. Before, I don't know if you remembered when I said it used to be used as anesthetic, that they were using 5,000 BPMs. That's just, and the limit is 300. I'm sorry, that's just crazy to think about. And then, so that's for 2 to 8 hours. Now, in drinking water, the maximum is 0.005 milligrams per liter, which is a very small amount. I'd like to talk a little bit about the molecular mechanisms of THC, which makes it so toxic. Now, it's a lipophilic and volatile compound that is mostly distributed in human body fat, the livers and the lungs when inhaled. So it's metabolized by the human body and by animals by metabolic pathways that oxidize nutrients. These metabolic pathways are known as CYP oxidation and CSH glutathione conjugation compounds. Sorry for butchering the words. But usually these pathways are not meant to process toxic compounds. They're actually meant to eliminate them via excretion. But when THC comes into contact with these compounds, it actually makes these pathways toxic. Now, on the left, I included a diagram showing the chemical compounds that go into its inhalation and how it's excreted, as I said before. So most of it is excreted when consumed, but the effects of it is still long lasting. So when it does come into contact with the peripheral and central nervous system, the chemicals can damage the pathways permanently, causing cancerous effects. Now, continuing on talking about the molecular mechanism, these compounds are found in the bloodstream. And this type of exposure can lead to immunogenic and carcinogenic cell damage via the TSC metabolites. Now, this GSH conjugation that I was talking about before, on the side here, you can see it reflected in the liver and the kidney. Now, that is included in dichloroethylene, glutamine, and dichlorphenylcytosine. And then the CYP oxidation derived from metabolites of TSC include chlorohydrate, trichloroacetic acid, and dichloroacetic acid. Now, the reason why I bring these complicated words up, is because I want you to understand how these two different neural pathways affect different parts of the body. Now, GSH metabolites primarily attack the kidneys, and they work to damage the kidneys and form mutants in the cell, which leads to cancer. Now, CYP metabolites primarily attack the liver. So the two pathways are being attacked at the same time, basically. So prevention. So I want to go base by base in each way that you can come into contact with it. The first way is eye contact, which we were talking before, of all those symptoms that can happen. To prevent those, you want to flush out the eyes with large amounts of water within 15 minutes, lifting up both the upper and the lower eyelids to make sure that all the contaminant is out of your eye. Now, if it contacts your skin, you want to remove your clothes. You want to wash your body with soap and water. And then if it's inhaled, you want to remove the person from where the exposure is and transfer them promptly to a medical facility. The time between the exposure and the sample collection, so the concentration of the sample, can affect the impact of this TSC. So basically, how strong the contamination is and how long ago that you actually were in contact with it can impact how it affects you. So if you were just around it and you were around largely concentrated amounts of it, it has greater effects than if it was years ago and if it was a small amount, like in your water. Now, individuals, total body fat, activity level, and metabolism can also impact the rate at which TSC manifests in test results. Now, if they have a strong metabolism and they can get the TSC out of their body quicker, and if they have larger amounts of body fats and they can work through it and they have a large activity level, it might not manifest as someone who has lower levels of body fat and who doesn't really exercise a lot and who has a weakened metabolism. And to prevent adverse reactions, you want to contain the product, and it should be being used outside. It shouldn't be used in inside environments, and it should be handled by the proper authorities. And then proper respiratory devices and protective gloves should be used when handling it. Now, there is no immediate antidote. There's no drug that you can take or injection. You just want to treat the symptoms and make sure there is no more traces in the body. Alcohol and central nervous system depressants actually make it worse. So you don't want to be using those. So sedatives, tranquilizers, and hypnotics should not be used when you have been affected by it. And then proper ventilation should be applied. In case of ingestion, 1 gram to 1 kilogram of activated charcoal should be administered to cleanse the body. Now, blood and urine tests are often used to determine how high the acid levels are in the body. And the body actually works to get rid of it. The body does not want TSC in it. So most of it is eliminated by the metabolism via the urinary tract. And then I wanted to also reiterate that poison control and the proper authorities should be contacted immediately. Their number is listed right there, 800-222-122. And it should not be just thrown away in the trash. It should be discarded properly. Now, my concluding statements are, although trichloroethylene is not one of the most toxic substances out there, it is not, if not properly contained, and treated, it can lead to fatal symptoms. Because of its ability to be found in household products, contact should be taken serious and discussed with medical and poison control officials. And then these are my references, and thank you for listening to my PowerPoint.